Huh? Such a good answer. Hey guys, Dr. Sil here, existential junior doctor from Sydney, Australia. I am in postgraduate year 2, which means I'm in residency in Australia. And in residency, you have to make some big life decisions. It's really the optimal time to decide what specialty to pursue. Now, I know in America, they usually choose much earlier, and in some countries, they choose much later. But in Australia, this is when we choose. Now, the field of medicine is so diverse, so it's very difficult to make that decision. I am at a bit of a crossroads now because I'm kind of 50% interested in 2 different pathways, and they're pathways that would take me into 2 very different lives. And I talk about them in another video that I can link to, but I thought today maybe I could do with some help. So today I'm just using some decision tools that you could follow along with as well if you are a medical student or a junior doctor thinking of deciding what to do. So let's bring them up. All right, the first image, sorry, I can't bring the image up by itself because it's not coming up when I click on it. It just goes straight to the blog post. But it's from the onthewards.org, which On the Wards is a New South Wales podcast, which is really good. But essentially, we go from the top. You're a people person, yes, no. So no, you're secretly, I am a people person. So maybe I'll just go through this as if it was for me and you guys can do it for you. But for me, I am a people person. The next question then is, you don't mind being vomited on. I've seen worse. Yeah, that's fine. A packet of sugar would call you sweet. I'm blushing. I don't know. I'm 50-50 on this one, so let's go down both pathways. Jack of all trades, nope, pediatrics, and yes, family medicine, which in Australia is called GP. Okay, I'm kind of interested in pediatrics, so maybe that's the pathway. If a packet of sugar wouldn't call me sweet, you guys will have to comment the answer to that question because I'm not sure. But if not really, then it's okay being covered in random bodily fluids, meh. Internal medicine, I don't think I'm geeky enough to do that. Like I don't think I have that in me. Or sure, they're both kind of positive responses to the bodily fluid question. Sure, think you could fly a helicopter without lessons. Bring it on, emergency medicine, nah. OB/GYN, okay, I'm going. Interesting. And how do I get to psych? You don't mind being vomited on, ooh, have your friends categorized by personality type. Yes, psychiatry. Very interesting. No, favorite hobby, reading, sports, reading, neurology, sports, right, rehab. Okay, so in this one I feel like I kind of went towards pediatrics and maybe internal medicine, emergency medicine, OB/GYN. But in terms of how I feel about all those specialties, I think the most likely one would probably be between psych, pediatrics, and emergency medicine. That's where I'm kind of feeling. All right, here's the next one. For some reason, it also doesn't come up. So let's go through this question as well. Now, what's the problem? I like everything, yes, family medicine, so GP. Yeah, look, I just don't feel like GPs get treated very well in the healthcare system. But I do like everything. Okay, I like nothing. How are your grades? Ugh, okay, my class hates me. My grades are probably okay to ugh. I don't know what my class hates me. Does that mean that you're really smart or really, maybe it just means you're antisocial? I would be between ugh and okay, between those two. Do you like people? Yes. Are you willing to touch them? Sure. Rehab? PM&R is, I'm gonna look that up. That's not an Australian specialty. Yeah, physical medicine and rehabilitation. And do I like people? Yes, but not willing to touch them? Psychiatry. I've never really given a big thought to rehabilitation medicine. Any of you guys thought about rehab? You let me know. Do you like people? No. Okay, so if you don't like people, you can consider pathology. I don't think I'll ever become a pathologist. I don't want to work with tissue my whole life. Okay, so if my grades were okay, which I probably am liking the area of ugh. Interesting that psychiatry is down the bad grades pathway. I would have thought you needed really good grades for psychiatry. But anyway, how are your grades? Okay. Are you a huge nerd? Yes. Pathology or neurology? That makes sense. Are you a huge nerd? Just average? What do you think of kids? I like kids, love them. Pediatrics, like them if they're asleep. And anesthetics, that's pretty good. They smell bad. How do you feel about sleep? Need it to live. Do you have ADHD? That's such a good answer. What'd you say? Good listen. Do you still not know what to do? Yeah, internal medicine. Okay, so essentially, this huge convoluted pathway is if you have no idea what to do, just do internal medicine. I feel like I'm forcing my answers towards emergency medicine, psychiatry, and pediatrics, because those are the things I'm interested in. Do people say meow when they see you? No, general surgery, go to hell, OBGYN. That's a weird question. All right, these are not evidence-based, for the record. All right, let's see this decision tree. Okay, so sorry about the fact that this isn't beautifully laid out. That's a bit better. All right, so medical student, are you crazy or sane? I am a little bit, let's just see what happens. So crazy, okay, that's good. So medical student, are you crazy? Yes. Do you have an attention span? Yes is psychiatry, no is emergency medicine. That's funny. Okay, maybe I'm crazy according to this. Am I sane? Am I hardworking? I don't want to work too hard. Not so much. Afraid of the light, then go down radiology. Afraid of the dark, dermatology, ophthalmology, if I think big versus small. That's interesting. I don't think I would be able to just focus on the skin or on eyes or on imaging for the rest of my life though. Attitude, nice. Yeah, I think I'm nice. Hates adults, do pediatrics, hates children, medicine. These are very divisive questions. It's like, you must hate them. Okay, so look, I don't know. This hasn't really helped me. All right, this one looks comprehensive, very comprehensive. Let's bring this one up. All right, here we go. This is horrible quality, I apologize, but at least we can read it. So let's go through it. I don't know what specialty I'm interested in. Do you like hammers? That's the first question. Oh my gosh. Do I like hammers? No, they give me calluses. I think so, not sure. They're useful sometimes. Okay, I'm in these three. I'm not that against it. Like, they don't give me calluses, but yeah, so I'm in these three. They're useful sometimes. Can hammers talk? No. Yes. Okay. So if they can talk, then you got to do psychiatry. All right, well maybe. Do you want to beat annoying patients with hammers? Wait, that's an option? Pathology? You didn't even know? No, it ain't no thing. Yeah, I'm not. Adolescent medicine? Your patience is second to none. Oh man, I didn't realize that was even a specialty. Maybe. Is it safe to? Is it effective? Medical scientist. These are very strange specialties I haven't heard of. Must be an American one. Anyway, it's still interesting to do. All right, so that's useful sometimes. Can hammers talk? Yes, do psychiatry. That's not very helpful, but very funny. Not sure if hammers can talk. Do you like hammered teenagers? Okay, so if you do like drunk teens, then emergency medicine's for you. And no, it's MC Hammer time, geriatrics. Okay, so if you want to avoid young people, go for the oldies. Do I want to do geriatrics? It's really hard to keep treating people who are close, who are so frail. I find frailty to just be a really hard thing to be like treating. You have to, like, I'm not a frail guy, I'm bouncy. And yeah, I find it hard to work with very frail people. I got to be very delicate with oldies. Also, it's very existential. You're constantly reminded of where you're going. And at the moment, it's not a particularly inspiring place, to be honest. I think getting old these days is really hard. We've lost a lot of the value for old people. They're not respected. They're left in these horrible nursing homes. The families, you know, kids focus on their own careers rather than on their parents who are aging. Maybe I shouldn't get into random rants. So anyway, I've seen a lot of sad deaths. Anyway. So that was down to the geriatrics pathway. Now if I go up, then we had emergency medicine. Okay, so now we're talking about if hammers, do I like hammers? It depends. That's good. That's a good answer. Can I find them in weird places, do surgery? Nah. Do you like hammerhead sharks? Sure. OBGYN. Oh, baby shark, Jesus. No, I do not like hammerhead sharks, family medicine or internal medicine. Can I break stones with a hammer, nephrology, urology? Oh, that's smart. Can they be used as a murder weapon, medical examiner? That's a very cool specialty. Look, maybe asking about do you like hammers is not the right first question on when you're trying to decide what to do with the rest of your life. That's what I'm going to take from that one. All right, well, I don't think that helped at all. Maybe it helped one of you guys. I don't know if it's always good to get you thinking. So maybe I should make a video just why I shouldn't do every specialty and see which specialty I end up saying, like having the worst reasons to not do, and then do that specialty. Maybe that's how I'll make this life determining decision. For those who don't know, my current plan is to take a locum year next year and do jobs in lots of different types of medicine to try and figure out what I like, and probably focusing on psychiatry or emergency medicine to see if I can see myself in 10 years being a psychiatry consultant. Or the problem with that being you lose a lot of your medical skills, which I find quite sad. I like medicine, I think it's fun. I like being in the ED as well. I think I would be better as an ED doctor, but I'd be happier as a psychiatrist. So should I do what makes me happy, or should I do what I'm better at? Everyone's career advice is do what makes you happy. I don't think it's that simple. That's good advice, but there's a lot of other factors to consider as well. There's no point doing emergency medicine if it makes you happy and then there's no jobs, because there's a surplus of consultants everywhere. Because then you might enjoy it when you're doing it, but you're miserable because you have to travel 2 hours to get to your workplace or something like that. So, complicated stuff. Anyway, that is it for this video. Thank you so much for tuning in. If you stayed till now, please leave the video a like, subscribe to the channel, join us on Patreon or as a YouTube member. You can check out the Doctors Getting Coffee podcast if you want to listen to some of my conversations with different consultants, which is very nice. And you can also join our Discord. Follow me on Instagram as well. I post daily on what I'm up to. It's lots of fun. All right, I'll see you all in the next video. Goodbye for now.